You can begin your dissection of the face, and we've already done some of this. We've cut along the lines that have been illustrated in your course book, and just wanted to point out a few things here. The first thing you should do is to put a new scalpel blade on your scalpel, because you will need a good sharp scalpel to do this portion of the dissection. Now, the thickness of the skin is going to change to some degree by the amount of fat on the body. And you can see we've left some of the fat at various portions here so that you can see the change in coloration from the fat, which I have right here, and then you're going to be cutting away thin layers until you come down to a change in coloration to this light brown, which is the musculature. And here we still have a tab of skin left, so that you can see that as you cut down, you want to do it in thin layers until you can see that change in coloration. And when you do so, try to stay in that plane, because those will be your muscles of facial expression. So after you've removed the skin from the majority of the face, you will be able to identify these muscles. And we only ask you to identify a few of them, and those are the ones, of course, around the mouth, the orbicularis oris, and around the eye, the orbicularis oculi, some of the more important of the muscles of facial expression. And then coursing down in the neck will be a very thin muscle which extends over most of the front and lateral side of the neck, and this would be the platysma coming down here. And as you can see, this is a very, very thin sheet-like muscle. So once again, you're going to be dissecting down to look for that coloration of the muscle fibers. In some cases, you'll go in and out of the plane. I think that you'll in your dissection, if you're careful enough, you'll see enough of these muscles to get the idea of how they run. After you've done that, on the lateral side of the face, as you're doing your dissection here, again, it's a change in color, so that we have some of the fat, which is bright yellow here and up in here. And in this region on the lateral side, you can palpate, it'll be beneath the zygomatic arch, and in front of the auricle here is going to be the area where we have the parotid gland. And once again, this is a gland that looks somewhat like the pancreas in the sense that it's slightly granular, and it will be extending on this whole side of the face beneath the zygomatic. Now, as you go anteriorly, there will be a fairly sharp border right here, which is the border of the masseter muscle, which you can see right here. And you should palpate that on yourself. When you clench your jaw, you can feel that very sharp border. And extending from the parotid gland right here, there will be the parotid duct, which I can just illustrate here. And it extends forward. There's going to be a pad of fat right in here. And you want to carefully dissect away, using a pair of forceps, this pad of fat, which would be just anterior to the masseter muscle, and you can actually follow the duct of the parotid gland going anteriorly. And when you dissect in this region, what you will find will be a fairly substantial vein, which I have right here, and an artery which lies next to it. And our artery has actually been cut during our dissection, and that frequently will happen. But we'll have the facial artery and vein which runs in this pad of fat. Now, after you've dissected this pad of fat out a little bit, and you've cleaned up the duct of the parotid gland, we will start to look for some of the branches of the facial nerve. Now, the facial nerve is very difficult to find because it runs through the substance of the parotid gland. And one of the easiest ways of finding it is that after you've isolated the parotid gland, you can look a little bit superior to it, and there should be a nice thick strand of tissue, and that's one of the branches, that's the buccal branch of the facial nerve. And as you travel or follow the branch of the facial nerve, it will disappear within the substance of the parotid gland. But by following this back, you'll achieve a plane so that you'll be able to cleave the parotid gland so that you'll be able to follow this branch posteriorly. So here's the whole branch right here, and it's going posteriorly, and it will become thicker, and you'll see multiple branches coming off of it, and you'll learn the names of all of these branches right here. So here's one coming up towards the zygomatic area, and follow that back until you find the main stem of the facial nerve. And we've done that, and as we've followed this plane back now, I'm able to illustrate here the main trunk of the facial nerve back in here. Okay? So here's the main trunk of the facial nerve. The next step is to revisit and just take a little more detailed look at the facial artery and the facial vein. The facial artery enters the face by coming up over the mandible, the brim of the bottom edge of the mandible, actually here where you can get a pressure point. And then this is another artery which has a characteristic coiled appearance. You need the coil so if the mouth is opened, the artery would not be torn. And then it traverses this fat pad where it may or may not be cut. It gives off branches on either side of the oral cavity, and then it's just going to continue up. Here is the facial artery right here, and it's going to go up towards the corner of the eye. This artery is accompanied by a very important vein that we'll be discussing in more detail, and that is the facial vein. It has basically a parallel course coming up over the edge of the mandible, traversing this fat pad that you can see right here, and it also goes up towards the angle of the eye. And in fact, these vessels, as they approach the angle of the eye, change their names and are often referred to as the angular artery and vein as they come up towards the edge of the eye, so that you should dissect these out in some detail. Now, the next step is going to be to look at the sensory nerves of the face, and we're just going to show first a skull, and this is a good exercise because during your dissections you should have your skulls available so that you can look at some of the landmarks which are going to be important in the dissection. I've already mentioned palpation of the zygomatic arch, and now in looking at the three branches, sensory branches of the trigeminal nerve, once again it's important to look at some of the landmarks. And starting down here in the mandible, we're going to look for the mandibular branch, or the mental branch of the mandibular division of the trigeminal nerve, right, coming out of this foramen right here in the mandible. And then just underneath the edge of the orbit, as I tilt this up, you can see this shadow right in here. This is another foramen from which the branch of the maxillary portion of the trigeminal nerve will be exiting, and we'll do this in our dissection. And then finally, there will be on the superior surface of the orbital brim right in here, there will be either a small notch or in fact a foramen that the supraorbital nerve will be coming out. We're going to look for each of these. To look for the mental branch, which comes out of this little mental foramen on the anterior surface of the mandible. And one of the easiest ways to do that is after you've approximated the site of the foramen is to reach your probe and run it along the bone until you find the aperture of that foramen, and usually you can come up with, as we have right here, a branch or the whole trunk of the mental nerve right here. Likewise, in looking for the infraorbital, so here is the orbit right in here, and we're going to look for this little foramen right here. I'm going to run my probe here. You can look for the inferior margin of the orbicularis oculi, and that's usually running along the brim of the orbit, so that if I push in here, I'd actually be pushing into the orbital cavity, and now right in here I'm going to be pushing into that bone. And if you run your probe in here, and you can see that the probe is now going into that infraorbital foramen, and if you simply do a sort of a scoop procedure, you will come up with the nerve right here. So here's the infraorbital nerve, which you can dissect out in a little more detail. In order to find the last of the sensory nerves, branch of the ophthalmic division of the trigeminal, once again, looking at your skull, approximate where the supraorbital notch or supraorbital foramen is. Once again, here is the brim. I can find the brim of the orbit right here. One way of doing it is just to separate some of the tissue, and you will be able to come up with the or a branch of the nerve shown right here. Okay, it's going to be running up on the forehead. And the other method for doing this is to take a scalpel, and I've already done this. I've cut all the way down to the bone, going down to the medial aspect of the orbit. And then I've cut across here so that I could get underneath and pick up all of the soft tissue and pull it forward. And in doing so, when you do that and you look on the undersurface, you will be able to pick up a number of small branches of the same nerve, the supraorbital nerve, as it courses up onto the orbit. And here's another branch right here, larger branch.
For orientation, the skin has been removed, so if you have not done so, please complete that before you go any further on dissection number 11. Right underneath the skin, you will encounter a very thin, delicate, sheet-like muscle of facial expression called the platysma muscle, which is anchored to the lower mandible, as you can see here. Extremely thin. This is in the superficial connective tissue layer just beneath the skin. You need to reflect that muscle, and in doing so, you will expose the external jugular vein, which also lies in the subcutaneous connective tissue layer. And this vein runs vertically across a very good landmark within the triangles of the neck, the superficial neck, the sternocleidomastoid. The external jugular vein lies vertical across the sternocleidomastoid muscle. This vein drains into the subclavian vein and into the internal jugular vein. The sternocleidomastoid muscle is an excellent landmark for differentiating some of the triangles of the neck. Posterior to the sternocleidomastoid and bordered by the trapezius muscle is a posterior triangle of the neck, the inferior border being the clavicle. The anterior triangle of the neck will lie anterior to the sternocleidomastoid, and its anterior border is basically the midline of the neck, right where the probe is. The upper border of the anterior triangle is the margin of the mandible. The important structures to find within the superficial neck dissection are four branches, cutaneous branches from the cervical plexus. They can be identified by their orientation and course across and to the skin of the neck. The one that I'm tracing right now is the transverse cervical branch, its name coming from the fact that it courses transversely across the neck. Another cutaneous nerve is the great auricular branch or nerve that you see right here, and its key landmark is paralleling the external jugular vein. It also has another landmark of heading towards the lobe of the ear and provides some cutaneous innervation to a portion of the external ear. A third branch is the lesser occipital branch, which just broke off and fell free here. It lies parallel to the posterior border of the sternocleidomastoid muscle. This is a cutaneous branch going to the back of the scalp, or the skin of the scalp. The fourth branch are stumps on this dissection, and actually as you do this dissection, most of yours will be stumps because as you reflect the skin, you're obviously cutting the terminal branches of these nerves. But I'm positioning here the supraclavicular nerve, which gets its name from coursing superficial to the clavicle, and then down into the skin of the anterior chest and over towards the shoulder region. So you may see multiple branches of the supraclavicular nerve. These are 4 branches of the cervical plexus that are cutaneous. They all make their appearance just behind the posterior border of the sternocleidomastoid muscle, about halfway along its length. There is another important nerve. It's a cranial nerve number 11 that is somewhat difficult to find in this dissection, partly because of the connective tissue that is so dense in this region when you try to dissect through the posterior triangle. Let me grab a hold of this nerve and try to hold it taut and position the trapezius muscle, which is lying right here. This is the spinal accessory nerve. It innervates both the sternocleidomastoid and the trapezius muscles. It can be differentiated from the supraclavicular branches that you will find by noting supraclavicular branches will follow a course superficial to the clavicle. The spinal accessory nerve will be a deeply positioned nerve that goes deep to the trapezius muscle because that's the muscle that it's innervating. Cut. A continuation of dissection 11 is a deep dissection, particularly in the anterior triangle of the neck. So again, anterior triangle is bounded by the sternocleidomastoid, lower border of the mandible, and the midline of the neck. So sternocleidomastoid needs to be reflected. This has been cut off the medial end of the clavicle and just turned back and reflect it. And then that exposes some of the other structures more clearly in the anterior triangle. This is the omohyoid muscle, which attaches to the hyoid bone located right here. So we talk about these muscles as being infrahyoid muscles and suprahyoid muscles. Omohyoid, therefore, is part of the infrahyoid group. Another muscle in the infrahyoid group is a strap-like muscle that is named sternohyoid muscles. You name these muscles based on their bony or cartilaginous attachments from sternum to hyoid. Omohyoid gets its name from attachment to the hyoid bone here, and omo means shoulder, and the other end of the omohyoid goes to the scapula. Deep to the sternohyoid, and we can see them a little bit lateral here, are really 2 more thin strap-like muscles, one of which I'm got the probe under right now, that runs from the sternum to the thyroid cartilage. Now you can't see the thyroid cartilage very clearly at this point because the tissue is covering it, but this is going to the thyroid cartilage, so it's called sternothyroid muscle. And then the next one in series with that continues superiorly as a strap-like muscle, thyrohyoid muscle. So those 2 are sort of in series or continuations of each other. So 1, 2, 3, 4 muscles all collectively within the infrahyoid group. Another important landmark I should point out is the Adam's apple or the thyroid prominence that you can see right here, and in the hyoid bone just above that. The suprahyoid muscles that we can see in the region just below the chin and above the hyoid bone. One right here is an anterior belly of a 2-belly muscle. This is the anterior belly of the digastric, and its posterior belly is back, more posterior, that we'll get to in a minute. Also overlying some of the digastric muscle parts is the salivary gland called the submandibular gland, and a portion of the facial artery curves through and indents the salivary gland. You need to reflect the anterior belly of the digastric. Just cut it from its attachment to the mandible, and this exposes the underlying sheet-like muscle that attaches from the mandible to the hyoid bone. And in particular, attaches to a line on the mandible called the mylohyoid line, and this is the mylohyoid muscle. Okay, and it's a sheet-like muscle, and it's paired. This is the right one. There's another one on the left side, and they meet and attach, much like the linea alba in the abdominal wall, in a midline seam, and they also attach to the bony hyoid bone, so mylohyoid. Innervation for anterior belly of the digastric and the mylohyoid is the same nerve. It's called nerve to mylohyoid, and it's a branch of V3. You will also need to make a midline incision, sharp incision with your scalpel, into the mylohyoid to separate the right and left mylohyoid muscles. And in doing so, you can then reflect this thin, sheet-like mylohyoid muscle and expose the underlying bundle, a strap-like muscle whose fibers run vertically from hyoid bone to the chin. Now, another name for the midpoint of the chin is the genu, and it's the bend of the mandible. So when you genuflect, you're bending your knee. There are other terms we'll see that use that Latin stem. This is the geniohyoid muscle, from the genu of the mandible to the hyoid bone. The other thing that you need to do in this dissection is to locate the ansa cervicalis. Now here I'm coming back to the omohyoid muscle, and just posterior to the omohyoid muscle and directly underneath the sternocleidomastoid is the carotid sheath and the contents of the carotid sheath. The large vein that you see is a lateral component of the carotid sheath is the internal jugular vein, and the common carotid artery is more medially positioned and slightly deeper. Lying right on the surface, within the connective tissue that makes up the carotid sheath, is a loop of nerve called the ansa cervicalis. Now this loop, you can see the inferior extent of the loop right here, with a continuation of a nerve bundle off the apex of the loop. And this nerve bundle is just innervating one of the infrahyoid muscles. All of the infrahyoid muscles receive their innervation from various small branches off this loop. The name of the loop, again, is the ansa cervicalis. Its location is easily found if you're scratching with a probe in the anterior surface of the carotid sheath, and you'll either see the superior ramus and or the inferior ramus that comprise the ansa cervicalis. Once you've found the inferiormost loop of the ansa cervicalis, which, by the way, can be variable in how far inferiorly or superiorly you will find it within the carotid sheath. This one's relatively low or inferior. But follow up the superior ramus that I'm tracing now, and you will see that it connects to the hypoglossal nerve, or the 12th cranial nerve. Now, to see that more clearly, I'm going to cut and reflect the facial vein as it is a tributary to the internal jugular vein, and bend these down out of the way, and in a moment I'll take those out completely and come back here and locate the superior ramus, and hopefully that gives you a little bit better view of the superior ramus and its continuity right in here with the 12th cranial nerve. This nerve, hypoglossal nerve, will be parallel to and just below the tendon, bright white tendon of the posterior belly of the digastric, as it's about to become the anterior belly of the digastric. So it's a good landmark for locating the 12th cranial nerve. So that's superior ramus, and it connects with the hypoglossal nerve. Now, its actual origin is not from the hypoglossal nerve. Its origin is from the cervical plexus. There's just an intermingling of fibers that take place here, and the importance of that is that the superior ramus predominantly comes from the C1 spinal nerve, the first cervical spinal nerve, and it exchanges or sends some fibers that hitchhike along with the 12th cranial nerve, and at this point they take this small branch and exit the hypoglossal nerve, and a very slender branch that comes across and innervates a muscle called the one we just identified as an infrahyoid muscle, the thyrohyoid muscle. So the innervation to the thyrohyoid muscle is C1 fibers that hitchhike along with the hypoglossal nerve for a while, but the actual origin is from the C1 ventral ramus of the first cervical nerve. We'll take out the rest of the internal jugular vein and some of the small tributaries in order to get a better look at the last portion of this dissection, which is exposing the beginning roots of the brachial plexus and the scalene muscles. So again, for orientation, this is the omohyoid muscle, and deep to that are large bundles of white tissue, nerve bundles, that are portions of the brachial plexus, beginning portions. The muscle tissue you see both behind the white bundle as well as anterior to the white bundle are the scalene muscles. There's an anterior scalene, which I'm pointing to right now. It has lying on its surface the phrenic nerve. And that's a good landmark for identifying the anterior scalene muscle. The middle and posterior scalene muscles lie posterior to the bundle of nerve that forms the upper portion of the brachial plexus. We just want you to identify the scalenes and the brachial plexus and go no further with dissecting that. We'll pick that up later. And identify the phrenic nerve as it lies on anterior to the anterior scalene muscle.